Thank you very much, Lisa, and thank you for the organizers for inviting me. It's really a pleasure to be here, and I'd like to start by congratulating all of you. JAMRAI 2 it's really an accomplishment that can build on the first JAMRAI. And it's really nice for me to see lots of familiar faces. Some of you I haven't seen in a long time, and others I've seen just last week. But I do hope that we will be seeing each other much more in the coming years during the lifespan of EU-JAMRAI 2. So in the next 15 minutes or so, sorry, the other way. There you go. I'm just going to tell you a little bit about the AMR activities that we've been doing in the European region. And then also, as was mentioned before, introduce to you the new roadmap for the entire region, which most of you are aware is twice the size of the EU and EEA countries, and how we're trying to go from evidence to action. But first, to tell you where we are, I have to sort of tell you where we come from. Of course, many of the EU countries that are represented here today have been dealing with antimicrobial resistance since the turn of the century. There's been a lot of awareness, a lot of experience, but that was not the case for a big part of the region. So in 2011, the Regional Committee adopted the European Strategic Action Plan, Antibiotic Resistance, which was really out of the notion that AMR was being neglected in a big part of the region. It was not an issue. People were thinking about other things. There was also a lack of systematic surveillance and sharing of data, and basically it was a blank canvas. So in 2011, what we needed to start doing is help most of these countries to get organized, to help them with their national action plans, which of course are a great opportunity to find out what needs to be done, by whom, by when, and how. So we supported that process, and also intersectoral coordination. I don't have to tell you that it's a multi-sectorial issue. So we've been, through our neutral position, we can convene stakeholders from different sectors that usually don't talk together. So we had a lot of stakeholder meetings, and we're facilitating this intersectoral coordination. As I mentioned before, AMR was not on the agenda in many of these countries, so we put a lot of effort into awareness raising. And in 2012, we joined the European Antibiotic Awareness Day and tried to expand the awareness raising throughout the region. A little bit later, we also developed the behavioral insight methodology, which you see on the right, the Tailoring Antimicrobial Resistance Programs, or TAP for short. And we started different programs, also together with some of you here in the room, and with co-financing of the European Commission. The other thing, of course, was also that the health workforce was not necessarily dealing a lot with antimicrobial resistance, so we put a lot of effort into training and education by generating materials, having workshops, etc., both on stewardship and infection prevention and control. And here you see some screenshots of an online course, of a booklet, and a roadmap on how to develop infection prevention and control guidelines. But of course, also building the evidence. One thing is being listed data from other countries, another part of the region, but of course, when you have your own data, this is when you can start making the argument that yes, it's also an issue here, and yes, we need to address it. So we put a lot of focus on surveillance capacity building, both for antimicrobial resistance and for consumption, using the same methodology as ECDC is applying through EARSnet and ESACnet that you're very familiar with. So we really wanted to have a pan-European overview, which through this work and together with ECDC, we're now are able to do. So you can see that these typical maps that ECDC has been producing are now expanded to the entire region. There's still a few countries that need to do a lot of work, and all countries can still improve, of course. So why a new roadmap? I think we've accomplished a lot in the past 10 years, but there's a lot of work that still needs to be done. One of the things that we know now, that most countries do have a national action plan, so they do have an idea of where to start, what to do, but unfortunately there's still many challenges, and one of that has been mentioned before. There's a lack of true leadership, and there's a lack of funding. Now, through the tracks that we send out annually, and I'm the one sending you these annoying emails about this survey, we know that less than 25% of all these national action plans have a dedicated budget. Now, without budget, it's difficult to move things. And the lack of true leadership has a lot to do with the complexity of AMR. One Health coordination remains challenging. But also, I mean, we're here as an AMR community, and we keep saying AMR is complex and it goes across sectors, but we're still one community. There's a lot of people we don't talk to. Now, if you don't have to go very far beyond your comfort zone to meet people that have no idea what you're talking about. And so many of the drivers for AMR are outside of the AMR community. So we need to link closer to universal health coverage, primary health care, and pandemic preparedness and response, to name a few. Still, there's also an issue with access to timely diagnostics, closer to the patient, but also quality medicines are challenging also here in the EU. And finally, we know that still a lot of healthcare workers, under the pressures that they meet every day, there's still a lot of skills that they need to strengthen. So basically what we want with the roadmap is to go from existing evidence to accelerate AMR action. So there's nothing new about it. It's actually, these are things that we know work somewhere under some context. We need to start trying them and either fail or succeed. Now, through a lot of consultation, this is the roadmap that we've developed together with you, together with other organizations. And it has one vision. The vision being that by 2030, which is an arbitrary date, but anyway, people and animals are safer from hard-to-treat resistant infections in healthier environments. Now, by mentioning people, animals, and environment, we're already sort of highlighting the first principle of the roadmap, which is to look at health through the One Health lens. The other principles are that we need to take a people-centric approach, so going a little bit beyond the bug and drug conversation and go more into a systems view. And about equity. The roadmap has three major outcomes. The first one is related to prevention, the second one to control, and the third one to treat, to regain the element of treatment. And then there's 5 action areas. It's just a way of organizing it. I mean, there's nothing magical about it, but these action areas are linked to the outcomes by color coding. And the first one is about prevention and control. The second one, environmental and social determinants. So here you already see we're going beyond traditional health into environment, but also the social determinants such as housing conditions, out-of-pocket payment, and all these things that are affecting resistance. The second 2 action areas are related to the control of AMR stewardship in the wider sense of the word, and community awareness and enabling behaviors. And the fifth one on the right is about access to medicines and health products, which includes diagnostics. As all these action areas will be very difficult to achieve and make progress unless you have these enabling areas also with you. And there are 6 of them in the bottom. There's regulations and legislation, governance and leadership, surveillance, laboratories, workforce, and at the far end, research, innovation, and digital technology. Now, these 5 action areas and 6 enablers altogether have 53 evidence-based interventions. So these are things that work somewhere. And the invitation is for countries to select some and start working with these. So if you look at the roadmap in itself, it's not an action plan, it's not a strategic framework, it's just a way of moving forward. So we had to turn this into a tool, which we call the AMR Compass. You see it still has the same elements. If you go from the middle to outwards, you have the 4 principles, you have the 5 action areas divided by outcomes, and then it's enveloped in these enabling action areas. So what we're doing right now is we're developing this diagnostic tool to help countries first assess where they are in these different areas. You know, what are our strong points that we need to maintain? What are our weaknesses that we need to work on? And building on these gaps, you can make choices and set national priorities. And once you have priorities in place, the next step is to set targets. And I think this is what ECDC has been leading, and is extremely important, because without targets, you don't know where you're going, and there's no consequence of not moving forward. And then, of course, the next step is to start implementing these evidence-based interventions, and then use the same process to measure your progress. Now, there is a document coming out called the resource document, which has all it has some examples and some references to all these interventions that we are mentioning here. I will not go into detail. It would take too much time. So basically, what I also wanted to quickly highlight is that, as Dominique mentioned, AMR doesn't have a face. It's because it has many faces. And what we're trying to do is to post a story every week, from World Antibiotic Awareness Week to World AMR Awareness Week, of stories of people telling how they experience AMR. So they're not all patients, they're not all healthcare workers, they could be restaurant owners, they could be veterinarians, they could be anybody, basically. So this is what we're trying to do over the next 50 or so weeks. And the hashtag is Stories of AMR. It's on all social media platforms, and hope you'll find that interesting to look at. The other thing I just want to end with is a quiz that we developed for you to test your AMR knowledge. I hope you will find it interesting. You see on the left what it looks like. It has a very familiar setup for some of you that like game shows. Yeah, so basically there's the QR code. I would advise you not to do it on your phone. It does work on your phone, but it gets very, very small. So if you go to amrquiz.euro.who.int, there's 10 questions for you that go a little bit across the different areas in AMR. Have a look at it and see what you think. And I also have to say there's a lot of background information in it. Anything that's underlined, you can click on. A box will open with some additional information. So hopefully it should be educational as well. So with that, and in good time, I'd like to thank you for your attention. And of course, the road to success is not straight, but there is some direction, and together we will get there. Now, good luck at the next few years, and we'll be there with you. Thank you.